Autism causes and myths. What is autism? Autism, also known as autism spectrum disorder, ASD, is a complex developmental disability. Experts believe it manifests within the first 3 years of life, stemming from a neurological disorder that impacts normal brain function. This affects a person's communication and social interaction skills. Some individuals with ASD typically experience difficulties with social and communication skills. They often prefer routine and may strongly resist changes to daily activities. However, if they are informed of upcoming changes in advance and given time to prepare, their resistance significantly decreases or is eliminated. Genomic research is beginning to discover that people with autism spectrum disorders probably share genetic traits with individuals with ADHD, attention deficit hyperactivity disorder, bipolar disorder, schizophrenia, or clinical depression. A team at the Cross Disorders Group of the Psychiatric Genomic Consortium suggests that the 5 mental disorders and illnesses have the same common inherited genetic variations. Autism is a wide-spectrum disorder, meaning no 2 individuals will exhibit the exact same symptoms. Symptoms vary in combination and severity. Individuals with ASD interact differently. Those with mild symptoms may appear socially awkward, occasionally offensive, or out of sync with others. In more severe cases, they may seem uninterested in other people. Lack of eye contact is a common observation among those interacting with individuals with ASD. However, with improved early detection and intervention, eye contact is improving. For those with less severe symptoms, eye contact can be taught as an important social skill. People with autism may miss social cues for attention and may not realize someone is trying to talk to them. While they may be very eager to engage with certain individuals or groups, they may lack the social skills for full participation, particularly in playful interactions and conversations. Understanding and being aware of the feelings of others, people with autism often find it harder to understand the feelings of others. Their innate ability to empathize is weaker. However, with frequent reminders, their ability to consider others' feelings can improve significantly. Through consistent practice, some empathy can become more natural, though it may never come as instinctively as it does for neurotypical individuals. Conversations with someone with autism can feel one-sided. They may appear to be talking at people rather than with or to them. They might be intensely focused on a particular topic, leading to less exchange of ideas, thoughts, and feelings compared to conversations with neurotypical individuals. While most people enjoy talking about themselves, individuals with autism tend to do so even more. Some children with ASD may not enjoy cuddling or being touched as much as other children. However, it's incorrect to generalize. Many will hug and enjoy physical contact with close relatives or teachers. Often, it's a matter of practice and anticipating the contact. For example, a sudden tickle might elicit a joyful response from a neurotypical child, but a child with autism, unprepared for the touch, might react very differently. Sudden loud noises are generally unpleasant and shocking for individuals with autism. Similar reactions can occur with specific smells and abrupt changes in light intensity or ambient temperature. Many believe the difficulty stems from the surprise and inability to prepare for the sensory input, mirroring the response to unexpected physical contact. If an individual with autism knows something is going to happen or is reminded of it, they can cope much better. The severity of autism often correlates with the impact on speaking skills. Many children with ASD may not speak at all. Echolalia, the repetition of words or phrases heard, is common. Predictability and routine are highly valued by some individuals with autism. Repetitive behaviors are often a significant part of their lives, which others might perceive as unusual rituals. These could range from a simple hop-skip-jump across a room, repeated for minutes, to repeatedly drawing the same picture. Neurotypical individuals are more adaptable to changes in routine. A child without autism might be fine with brushing their teeth after a bath, even if they usually brush first. For a child with autism, this seemingly minor change could cause significant distress. While helping children with autism cope with change is beneficial, forcing them to accept changes like others do could negatively impact their quality of life. 2 myths about autism. One is that autistic people have no feelings. This is a destructive myth born of ignorance. Individuals with autism experience love, happiness, sadness, and pain, just like everyone else. Their expression of these feelings may differ, but their capacity for emotion is undeniable. It is crucial to educate others about this truth in a helpful and informative manner. Another myth is that all people with autism possess extraordinary gifts. While not all individuals with autism have exceptional talents in areas like numbers or music, a significant proportion of those with ASD have high IQs and a unique aptitude for computer science. Reference: Medical News Today.
See the world in a different way. Let's celebrate neurodiversity. Yay.
Please reach out with any questions or support needed. Thank you for watching